today we are opening yet another phase in this fight against this deadly disease. As you are aware, His Excellency the President Uhuru Kenyatta, yesterday made some very critical pronouncements on the way forward. First, not to repeat, but just to highlight that movement in Eastleigh, Nairobi, and Old Town, Mombasa were lifted. And this lift of restrictions also applied to Kwale and Kilifi counties. Now, it is important for us to clarify that these actions do not mean that the areas that were affected are now COVID-free. It is simply because the observance of what we have been saying in those areas and the isolation of the cases, of the many cases that were in those areas, have been having an effect. And consequently, the number of cases that we pick from there are less and no more than other areas. And that's why we said that those areas, that's why the President ordered that action. But I repeat that it is not that the transmission of the virus in those areas has slowed down. And I want to appeal to the residents of the 4 areas not to become complacent and abandon all the containment measures. Any behavior to the contrary is likely to roll back the gains that have been made so far. Let me reiterate that the directive that closed down bars that sell alcohol has also not been lifted, because there has been those who have been saying that they are now free to start partaking of some of these things, some of them even saying that they are now free to order one Kagwe special. I would like to clarify that that is not the case. And we have also noted that various facilities opening for business and selling alcohol are on the increase, particularly in some estates in Nairobi, in Westlands, in the Kilimani area. We have taken note. And I would like to propose to the owners of those places to quickly, very quickly, follow the directives that we have given. Otherwise, if you are caught selling alcohol, opening a bar, your license is likely to be withdrawn, and for that matter, withdrawn permanently without any possibility of reopening again. Fellow Kenyans, you will also recall that the President reviewed the dusk to dawn curfew timings that have been in place for the last several weeks. This again is to allow for both employers and employees to have a full day of work shifts. We still continue to encourage those who can to work from home. And I think there is a good development here where some people have developed such a good way of working at home that is likely that that is how they are going to continue working even post-COVID. So we would like to encourage the use of technology. We would like to encourage as many people as possible to continue working from home. But in the event that, for instance, you are in Kazi kwa Mitaa and other areas that we have allowed, it means that you are able to to give a bit more time to work, and hopefully that has an impact on the economy. It will also allow those who are in marketplaces, provided that they are following the protocols, to be able to sell a bit more mama mbogas and so on and so forth, to increase a little bit the activities that they are doing. And it is important for us to reiterate that this is being done on the understanding that Kenyans are now aware, on the understanding that we comprehend and we will be following these rules. Because the escalation or de-escalation of the measures purely depend on what happens when we loosen a little bit. It is that understanding that we now have a partnership between each other, between the government and its people, between the people themselves, in between families. It is on the understanding that we understand what is going on around our country, that we are able to make people take more responsibility, because the more we open up, the more responsibility is given to Kenyans themselves. So I want to emphasize on the importance of individual responsibility in this fight. As we consider opening up more and more, it will be important that every person plays his or her role in the quest to limit the spread of the infections. It is now close to 90 days since our first case, and in that period, we are now better informed about our individual responsibility in this campaign. And I would like here to thank those in Nyumba Kumis, particularly upcountry in the rural areas, who have taken a very serious attitude about new entrance into the community, a new entrance into the counties, and reporting any case, particularly the cases of individuals who have traveled from epicenters of the disease, such as Nairobi and Mombasa, traveling up country. And I can tell you that they have taken it seriously. I want to thank the chiefs. I want to thank the sub-chiefs, chairman of Nyumba Kumi. You are doing a sterling job in informing the authorities and ensuring that you as a community speak to persons concerned and ask them to leave as quickly as possible. And that has been effective. And it is going to be even more effective when we start community health care, community care, and also more effective when we start quarantining in homes. Because it then becomes the responsibility of the Nyumba Kumis, the responsibility of families, the responsibility of sub-chiefs to ensure that those who are self-quarantining do so. It's because there will be those who will do so very effectively and very efficiently, but we are also aware that there are Kenyans who will not do that. So I would like to urge that that be the case. At the same time, His Excellency the President directed that all counties must have at least a 300-bed facility for COVID-19. Now, this doesn't have to be one facility. It can be divided into several facilities, but add up to a minimum of that amount. Now, I would also like to mention that this is a minimum. There are those counties who have already got a higher capacity than this, Mombasa being an example, that has already got more than 300 beds, and you'd like to continue to urge that this be the case. In Nairobi, for example, most of the facilities we have been talking about have been essentially Ministry of Health facilities, as in Bagathi and KU. We now want also to move to county, Nairobi county facilities, including Mama Lucy Hospital, and so on and so forth. So the Nairobi government, the Nairobi health sector is also been charged with the responsibility of ensuring that through the county health facilities, we also build that capacity over and above the government referral system. So today at our National Emergency Response Committee on Coronavirus, we proposed that the 47 county emergency response committees are to meet very urgently. As you know, they are shared by the governors and the county commissioners, that we urge them to take advantage of a 2-week period. Within the next 2 weeks, we accelerate and ensure that the directive of the minimum 300 beds is achieved, because it is very, very important that we do this. Otherwise, the extension in the time that the president gave, will not mean much. So we must make sure, as you are aware, we have dispatched money to the county governments. Originally, they were struggling. We have dispatched money, and we will continue to support. But I think that the idea of them being ready is crucial in the next phase of the management of this disease. And it becomes important because the numbers are not going down. The numbers are going up. In today, for example, is our highest ever report of 167 positive cases in the country out of some 2,833 samples tested. Now, it is also important for us to understand that this high number is also as a result of extremely targeted testing. When you look at the areas that these numbers come from, you'll see, for instance, there is a huge number from truck drivers in Busia and the other border counties. For instance, Nairobi has 54 cases. Mombasa has 47 cases, while Busia has 28 cases. Now, in the case of Busia, we realize that these are essentially truck drivers, but we are also going to have a government direct intervention in the Busia County because of the rising numbers that they have got there. But even the other counties are also increasing in numbers, including counties like Kiambu, now growing at 14 new cases. Uasin Gishu with some 11 cases. The Uasin Gishu, the 11 cases come from Soy. Soy has got 5, Tabo 3, and there is a case from Kapseret, from cases. So it's spreading in the counties, and this is why it is so critical that we ensure that counties begin to take responsibility. I think the test of a devolved system is going to be now, whether indeed devolution is going to work, whether indeed health as a devolved function is what it should be. I think this is a good test, and we are seeing a mixed bag of performances, with some counties doing extremely well and others lagging very far behind. So it is important that we all put it all together and we have a general standard across the country so that each county has got sufficient capacity. In gender terms, we still continue to observe that the male gender is taking a huge percentage of these things, of these positives. I think more so because, for instance, when you look at truck drivers, almost all of them are male. And therefore today, we have got a situation where 125 of the positive cases are male and 42 are female. Again, the reason why we keep on saying that those who are unwell must quarantine themselves is because when you think about it, today, for instance, we have an 11-month-old baby who has turned positive. In terms of discharges, today we have also discharged some 46 patients, which is a good number for discharge, but I wish we were discharging as many as we are bringing in, which brings the number of recoveries now to 752. Sadly, we also lost one person, bringing the total of fatalities to 84. Fellow Kenyans, as we continue to combat COVID-19, I wish also to acknowledge the long-standing partnership between civil society, professional organizations, media, development partners, with the Ministry of Health against fighting another case and another serious disease in our country, which is cancer. Today, we celebrate the National Cancer Survivors Day, an annual event held globally to honor cancer survivors and to show that indeed life after cancer diagnosis is possible and can be fruitful, rewarding, and inspiring. This day is an opportunity also to raise awareness about cancer and the importance of screening for early diagnosis. If we are to achieve better treatment, outcomes, and cancer survivorships, the key is early diagnosis. Our survivors prove that cancer is not all gloom and doom. and that indeed we can overcome cancer if we avoid risk factors such as tobacco, excessive alcohol use, as well as seeking health care early enough. As we celebrate life, we will continue to engage in addressing the ongoing challenges of cancer survivorship to promote resources, research, and legislation that will improve cancer survivors' quality of life in line with the universal health coverage agenda. In conclusion, let me repeat my appeal. We must be vigilant. We can beat this virus through solidarity, cooperation of the measures that we have given. We must behave responsibly to shape the story of this pandemic. By doing so, we will leave no one behind. Ningetaka tu, before I continue, I would like to invite my colleague, Dr. Kuti, just say a few words. As you know, Dr. Kuti, Governor Kuti is the chair.